for those of us, if you're not one of the 59 million who have already voted,
Nope.
and you and I aren't.
Week from today.
Yes, a week from today, early voting continues. But I started to think, and you and I have talked about, we are going to the polling place. And of course, this comes with some caution, I think, that we need to kind of employ. And we have Dr. Reagan Anderson on the phone with us, who's going to give us some tips. Doctor, thank you so much. I know you're up early this morning. We appreciate that.
Thank you for having me on.
Give us an idea. First of all, give us a little bit of your background first.
Well, I was a military physician for a number of years. I did 2 combat deployments to Fallujah, Iraq with Marine Recon. I got out, became a dermatologist, and now I'm a dermatologist in Colorado Springs.
And one thing you said, I'm assuming this is your motto: an educated patient is the best patient. Be informed
Absolutely.
and take charge of your health. I think possibly an educated voter would also be the best patient. Give us some ideas of what we need to do to protect ourselves, particularly in our area. It seems to us the lines are they're about a 30-minute wait. But if you're standing in line at the county offices to vote, or more particularly if you're going to the polls next Tuesday, what do we need to be aware of?
Well, I think that this is an election season just like all others. So some things are universal no matter if COVID is happening or not. So number one, research where you're going. Know about how long you're going to be waiting and where you're going to be waiting. Are you going to be inside or outside? Look at the weather for that day. Wear your hats, wear your sunscreens, bring some water, bring some food if it's going to be a long wait. So the basics are still the basics. And that also includes, please do not wear any politically motivated clothing. Please do not engage in any politically motivated discourse with anybody. So those are all the basics for whether we're in a pandemic or not. The next is I would wear a mask, and I would wear gloves. So just the regular old gloves that you can get at the local supermarket. And try not to touch your face, try not to touch your body. I would bring your own pen or your own stylus if it's going to be an electronic means of voting on a computer screen. And when you go in, go right to the booth, vote, throw out your pen, throw out your stylus, walk out of the building. Do not collect anything. Don't collect the I voted sticker. Don't collect any pamphlets. Just walk in, walk out. When you're outside of the building, put waterless hand sanitizer over your gloves. Let it dry. Take your gloves off and put waterless hand sanitizer on your hands, and then go about your business. Some people say go home immediately and wash your clothes and take a shower. If you want to, that's fine. But I think that if we just do not touch our face, if we wear our masks, if we socially distance, if we don't take anything from the voting booth or the polling station, we're going to be more than fine.
When it comes to masks, I've also heard that in a situation like that, might be better to wear what I'm going to call more the clinical mask and then throw that away. Do you advocate that as well?
Sure. I mean, the N95 masks do confer more protection than just a cloth mask. I'm not sure how readily available those are for everybody, especially on short notice. And so I think that the cloth masks are adequate for this purpose, especially if you're socially distancing and not engaging in conversation. Because when we talk to people, we tend to stand closer than 6 feet. And so if we just mind our P's and Q's and get in, do our civic responsibility and vote our conscience and leave, I think that is very appropriate. The one thing that I would also say is that the best way, the absolute best way to not get a serious infection from the coronavirus is to be as healthy as possible. And that includes your mind, your body, and your spirit. So your mind, there's a lot of stress happening out there. Talk to people. Get the support you need. Your body, eat well, exercise, have a carrot occasionally. And your spirit, do what is needed to have a healthy spirit. And I think that if we go into this election cycle and for the rest of our lives living in that way, then we're not going to be as susceptible to anything that comes our way, whether that's infectious or otherwise, and we'll be in a much better spot.
Why a carrot?
Well, why a carrot? I don't know. It was a vegetable. I mean,
Okay.
I know people who haven't had a vegetable in a week.
Well, that's true.
Yes.
I'm thinking peanut butter and celery or something anyway. But anyway.
Yeah.
No, I like carrots. The crunchier, the better, especially if they're sliced on a salad. And then, Doctor, each of our 50 states, of course, constitutionally is able to conduct their elections as they see fit, and so I suppose we're going to see some different things in our polling places than we've seen before.
100%. And that's why I started off with, figure out what is needed for your individual polling station. You can go to vote.org and look up your individual circumstance. Most places have early voting, so I would really strongly recommend people not showing up on Tuesday with the mass crowds. I would recommend showing up, today, tomorrow, something like this, where there's not going to be as many people, you're not going to be waiting as long, and just by sheer numbers, you'll be safer.
We've been hearing about people waiting 2 to 3 hours to go early vote.
And that is true, and you're going to see people waiting 8 or 9 hours or 10 hours on Tuesday.
Do you really think so?
100%.
Wow.
100%. Because normally, a normal voting period, at least when I voted in person, I'm in Colorado, so I do mail-in voting for the last decade or so, but when I had to stand in lines, it was always 2 or 3 hours just for a normal voting time. Well, now that everything is going to be spaced and it's going to be distanced, they're going to be cleaning things in between voters. It's going to be enormously cumbersome and way longer. So vote early, but please do vote. Just do it smart. And some people say bring in your own sanitizers and wipe the polling station down, but please don't do that. You could either destroy your ballot or you could destroy the electronic equipment.
Sure.
Just go in and follow the rules and you'll be fine.
You're reading my mind. I was going to ask that question. Can you bring in the Clorox wipe?
Well, if I go in all masked up, and I've got on some surgical gloves or whatever you can buy at the store, and maybe my jacket. I mean, it is November, and it's snowing here in northern Illinois today. I may not actually physically have my skin touch anything, right?
That's correct.
If I'm all done up. And so maybe they don't need to go in and clean up after me as much, because I'm going to have my own pen. I'm just not going to touch a thing.
Well, that's good. I mean, I think we all need to be as self-sufficient as possible, but I'm sure that they're still going to have their protocols for cleaning in between. And the other thing is I don't want people bringing in their own disinfectant wipes, because not all disinfectant wipes are created equal. And, most of the disinfectant wipes out there don't cover tuberculosis or other infectious diseases. So please remember, there's a lot more out there than just COVID. And the polling stations, the medical community, everybody has to be very sure that they have the right wipes. And one of the requirements is it needs to slowly dry over a minute or two in order for it to achieve killing of viruses and killing of bacteria. And so while you can get some decent wipes, at the local supermarket, I doubt that they're going to meet all of the stringent requirements that are needed by either medical or voting or government offices.
And I suppose, you're the medical professional in the conversation here. We still don't know everything about COVID. Is it surface-based or not? It was, then it wasn't. Are we back to possibly it is again?
Yes, it is. It is on some surfaces, and different surfaces will allow it to live and be able to be infectious longer than others. So, we don't know everything about anything in medicine. Everything. And this is a really important point. People are saying, well, Dr. Fauci changed his mind. And, yes, that's called the scientific principle. Otherwise, we're back to bloodletting and leeches. But we have to continually test our assumptions in medicine. And it doesn't mean it's politically motivated. It doesn't mean that it's disingenuous. It means that we are following the scientific principle. And what we are doing is we are continually making adjustments to what we think. Coronavirus is a completely new thing, so we're going to be making adjustments for decades.
And data drives the bus, I assume. So,
well, hopefully agendas and personal opinions and trying to find just the right article on the internet to support your point of view and throwing out all the other contradictory articles. Hopefully that nonsense is ending. Science is not political. Science is science, and it's a process.
You said the basics are still the basics, and as I sit here listening to you, I'm thinking to myself, these practices that you laid out for us can be used in a multitude of different situations. I mean, even with all due respect, if someone's coming to see you, they might want to mask up and glove up.
Oh, absolutely. So I scour my clinic. I mean, my anal retentiveness from the military is alive and well in my clinic, but we still have people social distance. We still require masks. You can't be seen unless you have a mask, unless there's a medical reason why you can't wear a mask. Mm-hmm. And then we clean the place between every patient. We're doing all these things for people, and I'm pretty sure that that's going to happen at the voting booths as well. But also, eating your carrots, that applies in my clinic as well as at your place of work.
I have 15 minutes to go get my partner a carrot before we hit the next segment here. Doctor, thank you so much. Anything else you want to share with us?
I had a
before we let you
banana
go?
about a half hour
Okay,
ago. Does that count?
Yeah. No, I'll just say, listen, the pandemic is going to come and go. As my grandfather said, this too will pass. But what will never pass is our ability to be as healthy as we possibly can be, so that we are not as vulnerable as we could be if we weren't healthy, and so that we don't need to consume medicine in the first place. That should be all of our missions. Live healthfully and live up to our potential.
Great. Dr. Reagan Anderson, thank you so much. We appreciate your time this morning.
Have a beautiful day. Thank you.